Yes, but I mean, you have to consider that a COVID death person is a person who has a positive COVID-19 test, basically. So if you have a heart attack and you have a positive test, you're in that statistic.
This is again a first time in public health.
Yes.
Death certification.
And then if you don't make a test, you're not in the statistic. Even you might have been dying from a respiratory disease. But if in a country where they do less testing, they have less cases. So what I wanted to say is, how reliable are these numbers? You know.
How will you believe the numbers? That's why I have not taken the cases. Yeah. The most accurate we can take is the death from COVID. And as you rightly said, a person may die of a heart disease or some other comorbidity, and that person incidentally has a positive RT-PCR. Yeah. And he or she is labeled as a COVID death. In fact, there are reports that in USA, a gunshot person dying of gunshot wound had a RT-PCR positive, has been labeled as a COVID death. So this has again, the death certification has never been distorted like this in anyone. Like we are carrying thousands of viruses and bacteria in our throat, nose, skin.
Yes.
I can pick up a staphylococcal, I can pick up a staphylococcal from my nose, streptococcus from my throat, and I can say, why not it's a streptococcal death?
Exactly. Because this is also one point, if you just test on one thing, even if the person dies with a respiratory disease, maybe it was influenza B, which was stronger than
more people died with COVID rather than due to COVID. There is a published paper on it. In fact, initially CDC also had given it, then it retracted. It found that only 6% of people are directly attributed to the virus. 96% had 3 or 4 comorbidities. So that is one thing, and therefore these things are a lot of confounders, because as you age, you have got diabetes, you have got heart disease, you have got so many. Person is mortal. You see, even John Ionitz, he has mentioned in one paper that even a person who is elderly, who is frail, who is bedridden, even if she or he is infected with a common cold virus, the mortality is 8%. A normal common cold virus can kill a person who is bedridden and frail. So this is killing 5% now, or